Well, for a broader look at healthcare in Venezuela, I spoke with Dr. Kate Tulenko. She's Vice President of Health Systems Innovation at IntraHealth International. She began by exploring the biggest healthcare threats facing Venezuelans.
Well, this is such a tragedy. Venezuela had over the years built up a very robust healthcare system. But the big threat that's occurring now is that with the economic crisis, the government has less budgets to spend. They're purchasing less drugs and equipment. They're not able to pay people as well. And so what's happening is medical supplies and drugs are being stolen from the warehouses and hospitals. About 20% of the physicians have left the country seeking better pay and working conditions elsewhere. The government actually estimates that about 40% of the beds are inoperable because there's not enough drugs and not enough medical supplies. And about 1 in every 3 people that enters a hospital dies. That's a shocking mortality rate.
Now, obviously, this is also a hot political issue. We have the opposition leaders and the governments really coming out with two different versions of things from what's happening in this situation. And one of them is about infant care. We recently saw images released, opposition leaders say, of newborns in cardboard boxes. The government disputes the validity of these images. What's really happening? Let's start with looking at infant care. What's happening there?
Well, from what we're able to find out about, there does indeed seem to be a shortage of basic medicines that you would need for newborn and infant care. You know, antibiotics, painkillers, steroids, other, just critical drugs. Even performing a basic surgery such as a cesarean section would be quite difficult. So we do seem to think that there actually have been negative effects, and it has become political. The government, although they have released these shocking mortality statistics, they say there is no crisis. They say they've opened up 2,000 urgent care centers in the last couple of years, and they claim that the opposition government is trying to privatize the healthcare system. And so that's the political fight that we see.
So if the government's stance is that there is not a crisis in the healthcare system, what does that mean then in terms of funding? If we're seeing that there are these shortages in medicines and doctors even going overseas because they're just not being able to do their work?
Yeah, I mean, despite the government claims, I mean, there clearly is a funding problem. And also we have to remember that this funding problem is occurring on top of several public health emergencies. Venezuela has Zika, and with shortages of bed nets and insect repellent and contraceptives and condoms, people are having a hard time protecting themselves, and women are having a hard time avoiding getting pregnant or protecting their fetuses. And in addition, as infrastructure declines in Venezuela, water quality declines and sanitation hygiene become very difficult. And as food shortages increase, people become malnourished and are less able to heal and less able to fight off infection.
And as people become more desperate, they are taking more desperate measures. We're seeing a lot of people turning to the black market. So what impact is the crisis having, especially when it comes to black market pharmaceuticals?
So since the pharmaceuticals are basically either not being purchased or those that are purchased are being stolen. And so if you have a family member who needs medicine, you can't go to the pharmacies, you can't go to the hospitals, you have to sort of go to the street, to the black market and buy it at extremely inflated prices. You know, I read one story of a man who had an injury and he had to pay for his medicines, which amounted to about 30% of his monthly salary just for a few days of medicine. So it's really making a lot of medical care out of reach of most Venezuelans.
Now, what about safety inside of hospitals? As you mentioned, some robberies taking place, people trying to get medicine, perhaps even taking from other patients. What's being done then to protect patients or people visiting the hospitals?
My understanding is that they have tried to increase security, as far as having more police or more guards there, but also in addition to, security around violence or theft, there's also, frankly, the safety issues of infection, that physicians and nurses don't have the gloves, the gowns, the masks to protect themselves. The wards aren't being cleaned as often as they would be, and so patients are at risk as well. And so safety in all ways is being compromised. And needless to say, it's not particularly safe to keep a newborn baby in a cardboard box.
Now, understandably, there's a lot of focus on the immediate issues, but a lot of people aren't really talking about the long-term impact of having a healthcare crisis. Things like mental health, people not getting their medicines, what that does as the population gets older. What are you seeing in terms of the potential long-term implications?
Right, there are a number, and short term, sending volunteers, sending drugs and supplies will help. But actually, long term, what probably needs to happen is Venezuela actually needs to address its corruption. Venezuela ranks 158 out of 163 countries in Transparency International's Corruption Perception Index. So it's one of the most corrupt countries in the world, and so a lot of the money that would go into the healthcare system is being siphoned off. Nigeria, which is another oil dependent state, also corrupt, a little less corrupt than Venezuela, according to the index. It's largely avoided these problems by having a crackdown on corruption during this economic crisis. But as far as long-term health effects, we can see more chronic disease, more untreated mental health problems. And I think long-term, it'll be very difficult to reverse this outflow of health workers. To replace 13,000 physicians, I mean, that's probably a decade's worth of output of Venezuelan medical schools. So it's going to take a long time to recover from that.